Our names are Katherine Saltzman, Johanna Waldenberger, and Jéssica Oliveira. We are research master students at Utrecht University studying urban and economic geography. Today, we are discussing our recent project, the role of delivery drivers in the pandemic and their perceptions on health and safety in Brasilia, Utrecht, and The Hague. During the COVID-19 pandemic, food delivery workers, many of whom are part of the freelance and gig economy, served as important links between restaurants and consumers. According to new research and newspaper articles, delivery drivers had an important economic role in helping restaurants maintain business, and have protected public health and prevented virus spread by delivering meals, supplies and services to customers, and allowing people to remain home. Gig workers are navigating the pandemic without traditional employers to provide safety guidance and provisions, sick leave, and financial support. The pandemic has put additional pressures on the gig workers, according to researchers. These pressures include an increase in workers as a result of high unemployment rates, increased competition and wage loss, exposure to the virus, and inconsistent access to employer-provided protective equipment and worker compensations for sick pay. In Brazil and the Netherlands, gig workers were deemed essential or frontline workers. This research explores the perceptions of health and safety among delivery workers operating during the pandemic in Brasilia, The Hague, and Utrecht. Our conceptual framework focuses on frontline workers, OSH standards, and the gig economy. We chose to study these cities because of their apparent differences in responses to the coronavirus, workforce inequalities from coronavirus, as well as differences in urban geography and in terms of traffic navigation. The qualitative research methods we chose are online interviews with food delivery drivers and restaurant owners in each of the respective cities. Interviews with delivery drivers were conducted to gain in-depth insights of the participants' feelings and perceptions of their own safety and health, and to understand how workers navigate during the pandemic. Interviews with restaurant owners and employers were used to reinforce and confirm statements made by the delivery drivers. We gained background information on how restaurants implement COVID-19 safety measures and limitations to protocols, as well as their perspectives on delivery driver health and safety. Participants were recruited during their shift or through personal contacts. We included drivers who work for delivery apps such as Uber Eats, Hausbezorg, and iFood, and some drivers who work for restaurants directly. In total, 4 interviews with delivery drivers were conducted in Utrecht and 3 both in The Hague and Brasilia. The interviews are subsequently coded, and coding schemes were developed until saturation. The most important codes that emerged were governance, employment and workers' rights, inequality, mental health, COVID-19, road safety, and responsibility.
During our research, certain trends emerged regarding perceived safety for delivery workers. These included coronavirus precautions, such as PPE provisions from employers and functionality of contactless drop-off and delivery, as well as more general perceptions of employer considerations of worker safety and workers' perceptions of financial safety and mental health. Regarding PPE provisions, we found that many of the platform employers issued guidelines and protocols for PPE distribution and contactless delivery on their website. Workers experienced the rules in different ways. While participants working for platforms and restaurants indicated that masks were available through the employer, there were differences in how workers received masks, what type of masks were available, and whether the allocated supply would last for the entirety of the pandemic. Despite differences in PPE allocation methods, our participants in the Netherlands largely felt that their employers were providing protective equipment and following orders on mask safety. In Brazil, workers expressed more frustration with lack of PPE supplies. Contactless delivery was another recommended precaution that workers in Brazil and the Netherlands felt gave privileges to the customers, but jeopardized worker safety. One 0-hour participant explained that at the start of the shift, a dispatcher reminded workers to have contactless deliveries. However, in certain situations, customers have requested that deliveries be passed through unconventional ways and require workers to make hand contact. In Brazil, a freelance worker expressed frustration that contactless options gave customers more leverage, but workers at a higher risk and jeopardized their ratings on the platform. He told us, "Yeah, they still ask me to go up, and if you don't go up, they will give you a bad review, get upset and trash the delivery guy at the app, and that is very detrimental to us, because the more dislikes you got, any bad evaluation." Comparatively, a restaurant franchise owner who manages his own delivery staff said that to keep the 1.5 meters distance, workers would sometimes leave the delivery on the floor for customers to pick up. Customers were not happy about that, but he did not mind or was unsure about an alternative option. Another consequential impact of COVID on delivery systems in both countries is the complexity of working under the guidance of platforms, but also dealing with demands and needs of customers and restaurants. Though delivery drivers are front-end workers, there is limited appreciation and support for them. While restaurant owner participants who used their own delivery staff spoke about coronavirus and physical safety and maintaining staff on payroll during the pandemic, restaurants that used platform delivery seemed indifferent to delivery workers. This impacted how workers perceived their frontline status and whether they felt appreciated for their important economic and public health role. There was also significant difference between Brazil and the Netherlands regarding perceived responsibility and appreciation. This could be partly explained by the low social status experienced by delivery drivers in Brazil and the prejudice they suffer because of it. Another factor that can be taken into consideration when analyzing these differences is how much more of an unequal society Brazil is, and how the social strategies of dominance are more prevalent than those more appropriate to living in more equal societies. More cooperative, reciprocal environments. There were also concerns about financial safety for workers in both countries. Although workers with 0-hour contracts in the Netherlands, for example, thuisbezorgd and restaurant workers, expressed more satisfaction with their job and salary, whereas workers in Brazil expressed anxiety about financial situation, increased competition and lack of union support or collective action for additional pay. Financial safety is determined by drivers' employment contracts and the lack of social security net available to them, and thus it influences their perceptions on health and safety. A representative from the Dutch FNV Riders Union pointed out that most complaints during the pandemic, especially in the beginning, were about not earning enough money to make ends meet. On the other hand, workers with 0-hour contracts felt more protected by their employer and more financially secure compared to a freelance gig job, even if the pay could be higher. As one 0-hour contract worker noted, quote, "So personally, why I work at thuisbezorgd is the security of knowing I will get the money anyways." Mental health. In our initial research, we found that OSH regulations also included mental health and well-being, and therefore also asked about this in our interviews. Mental health concerns were identified as factor that influences delivery drivers' perceptions of health during the pandemic. There was no unified answer, but most interviewees from Brazil felt that their mental health was not an issue, whereas most participants from the Netherlands gave a more detailed answer. In Brazil, other factors such as financial and physical safety were found to be more important. In the Netherlands, participants saw delivering as a way of relieving stress and dealing with personal anxiety better. This discrepancy is an indicator for the prominent differences in the two societies, with participants from Brazil being more financially dependent on their job as compared to Dutch participants. Mental health is a sensitive topic and can be influenced by cultural and social norms of the respective society. Therefore, there may have been limitations in responses.
In conclusion, we found that workers in both countries expressed mixed responses on whether the frontline status reflected their work. Some cited their job provided a luxury service, while others said that their work was essential to provide meals to individuals in quarantine or in high-risk categories and unable to leave their homes. Most delivery drivers with freelance and zero-hour contracts in Utrecht and The Hague reported their platform employer was supportive, but in Brasilia, workers expressed more frustration, citing low pay, inconsistent PPE provisions, and little appreciation despite their frontline status. We found that OSH guidelines were ineffective at protecting delivery workers, especially as workers navigated with restaurants and customers. While workers were very cautious of their health and safety at work during the pandemic by always wearing masks and trying to adhere to contactless delivery, workers in both countries expressed concern and apprehension when customers and restaurants neglected coronavirus safety protocols. Gig workers experienced greater economic obstacles and inconsistencies in communication and protocols compared to workers with traditional managers or zero-hour contracts. This trend was more apparent in Brazil. While restaurant managers with their own staff spoke about precautions for their workers, for example, eliminating delivery timers to reduce accidents and ensuring workers were on payroll despite the pandemic, there was limited employer support for freelance workers. For further research, go-along rides with delivery workers would provide better insights in daily work behaviors and interactions with restaurants and customers. Additional research on new business models that recognize flaws in the gig economy system and are working to make delivery more ethical and provide drivers with better work conditions and wages is recommended. Thank you.